When we talk about digital pathology, we often focus on the scanners and slides, but what about patients? I'm at the PathVisions conference, the largest digital pathology conference, and the through line of this conference is from pixels to patients. So basically how this technology translates into better patient care. The first problem of the classical workflow is the turnaround time. They're basically long, and for subspecialty expertise, even longer than normally. Patients in remote areas don't have access to subspecialty expertise. So how can digital pathology help? One of the things how it can help are remote consultation. And there has been a presentation by a company, Path Presenter, who is partnering with another company, scanner company, Grandium, that are enabling a network of hospitals, of healthcare providers that are not yet digitally enabled to be able to tap into the consultation with specialists from top hospitals, with experts that are recognized worldwide. So this can be done internationally and currently within this program at no initial cost. In addition to enabling institutions that are not yet digitally enabled, the creation of digital diagnostic materials, the digital slides, helps you deploy cutting-edge tools like AI on the slides to help diagnose even faster and more accurately. There are algorithms that can point the pathologist out to the lesions, that can triage cases, that can flag cases for specialist review. So there is huge potential with using AI on pathology slide. And obviously, to be able to leverage that, you need a digital slide. You cannot really do it on glass. And the newest leverage that we're gaining with AI is the integration of large language models. Now that we have digital images, we can also use the text AI to query images together with the reports and take the patient care to the next level. And helping patients is not limited to the point of diagnosis. There's a lot more when it comes to investigating disease for drug development, drug discovery, and helping patients is not limited to the point of diagnosis. Then they're already sick, right? They need immediate care. But what about all the research that goes into producing new drugs, into understanding disease? Now with digital images, so much information that was not accessible before can be unlocked. Here I'm referring more to the drug development and drug discovery process, figuring out pathways that can be targeted to find new drug candidates, but also at the level of clinical trials. Clinical trials are actually in special need of digital pathology because they are notoriously difficult to conduct. Basically, connecting patients from different places that are not digitally enabled with centers that run these clinical trials, there is no instance where you will encounter more hurdles that could be addressed with digital pathology. So clinical trial matching, clinical trial consultations, remote diagnosis, and everything where digital slides can be leveraged to give access to pathologists, because it comes down to, is there a pathologist that can evaluate it fast? And if we are tied to glass, it's not going to be fast because it's going to be shipping back and forth to multiple institutions, and it's going to cause delays, and when we have delays, then those patients don't get treatment. But for clinical trials, in addition to management and to getting fast diagnosis, we need to have tests that discriminate which patients are going to respond to which drugs. And now in the time of personalized medicine, it's not as easy as one drug curing it all. You need to find the personalized biological profiles and biomarker profiles of the patients, and then only use the drug on those patients that actually will benefit from the treatments, because many of treatments have a lot of side effects. So this is something you can do on digital images. And it was presented at this conference and a couple of other conferences, but at PathVisions as well. Their AstraZeneca, a pharmaceutical company, has an image-based biomarker that can discriminate between the patients that are going to respond to treatment and those who are not going to be responding to the treatment, and they're using it in clinical trials. This is the continuous scoring of a TROP2 immunohistochemistry biomarker, where there is a ratio of the biomarker expressed in the membrane and in the cytoplasms of the cells, and this would not be possible on non-digital images. So as you see, digital pathology is definitely not just nice to have, not just a tool that pathologists like to use, but something that is a launch pad to increasing access to care. And I believe that patients deserve fast diagnosis, and the gateway to fast diagnosis is digital pathology. So I bring you this information about digital pathology, and if you're interested in what kind of tools could be used for digitization of slides, one of the tools is right here. This is the Grandium scanner, and you can watch a video about the scanner right here. And I talk to you in the next episode.